My name is Charlotte. I look after the youth membership scheme at Centre of the Cell, and in this video we're going to be talking about work experience in the context of applying to university. So if you want to study subjects like medicine or dentistry, as you might know, you are expected to get a certain amount of work experience before you apply. On the other hand, if you're looking to study subjects like chemistry or biology, then you don't need to get specific work experience in order to apply for these subjects. However, you do need to demonstrate your enthusiasm and passion for your subject, and you also need to show that you have the skills required in order to study at university level. So in this video, we're going to be talking about some of our tips for work experience, and we're going to be sharing some of our own experiences.
Hi, I'm Safia, a second year medical student here at Barton, London. So I applied for medicine straight after A-levels, so I did my work experience in the summer after year 12. But I decided really late on in year 12 that I wanted to do medicine, so I was very stuck for time when trying to sort something out. Luckily, my school helped me and I had 4 amazing days of work experience with an anaesthetist, shadowing and theatres. I was keen to see the role of a doctor in another setting, so I really wanted some GP work experience. I called round all the GPs in my local area but had zero luck. Fortunately, one of my relatives knew a GP who was willing to let me shadow him for a day. I got to sit in on lots of consultations and see the interaction between the GP and patients. Having no doctors in my family or friends network meant that my work experience was really valuable, as I got to ask a lot of questions about the role, the job, where it's going, all these questions that I just couldn't get answers to otherwise. Medical schools vary in terms of what they require or would ideally like in terms of work experience, but they do appreciate that it can be hard to get. Try not to worry too much about the length of what you do or what you get to see. It's much more important that you gain an understanding of the role of a doctor, the qualities that are needed to do the job well, and what working in the NHS is like. Medify has a really useful map of all the hospitals around the UK with links to their pages on work experience, so you can easily find out what your local hospitals require. For GPs, you'll need to email or call them directly. You can try all the ones in your local area, although your own GP won't accept you for confidentiality reasons. Volunteering is another great way to show universities that you've developed skills and get real hands-on experience. This allows you to develop different qualities such as teamwork, initiative, and communication. It also shows long-term commitment. Some ideas of places that you can volunteer in caring roles are care or nursing homes, St John's Ambulance Cadets, in hospices or in nurseries. Some hospitals take on volunteers too. I volunteered at a special school for 2 years, 1 afternoon a week during sixth form, before I even realised I wanted to do medicine. It's an experience that I'll treasure forever, working with such an amazing group of children. It was here that I really learned what it takes to do a caring role.
Hi, my name is Emma and I'm a 4th year dental student. My work experience was actually spread out over several years without me even realising it. I always knew I wanted a career in healthcare, but when I was 14 and told to organise my work experience summer placement, I didn't really know what that meant for me yet. The advice my parents gave me was to try my local pharmacy. No one in my family worked in healthcare, so this was kind of a good start. And looking back on it, the placement provided so much valuable hands-on experience. I became familiar with common medical complaints and prescriptions and what different services can prescribe compared to dentistry and medicine. It gave me a real insight into sort of professionalism and working under the NHS. A few years later, I'd reached the decision to go into dentistry. I found it really difficult to get dentistry work experience, so it's better to try and look for it as early as possible rather than delaying it. I managed to shadow a dentist for 1 week in an NHS practice and a dentist for 1 week in a private practice. A comparison between the NHS and private practice I think is really important because it often comes up in interviews. It's a really good question, they like to ask it. They like to know that you know the 2 different sort of career prongs that exist for dentistry. Aside from directly seeking out work experience, there were volunteering roles that I took on over my GCSEs to my A-levels. I became a youth leader for the local Scouts group, working with children between 5 and 8. This role actually prepared me a lot more for a healthcare degree than some of my work experience. I learned about safeguarding children and first aid techniques and communicating with the public. It's really important to gain direct knowledge and understanding of dentistry before you apply. Be persistent. You should contact as many local practices as you can and don't get disheartened. You will get told a lot of no's, but when you do get that one practice that will take you, it is a very rewarding feeling. If there isn't direct shadowing of a dentist available to you, don't panic. There are loads of different ways in which you can get dentist work experience. I would recommend for practices that you know, ask if you can shadow the reception. This will give you an opportunity to see the kind of patients, see what interactions happen, see what kind of data protection exists, and also give you a chance to actually talk to the dentists themselves and see what they recommend about the career. You could also ask the dental practices if they could put you into contact with the dental laboratories that they talk with and that they get their work done by. Doing work experience in a dental laboratory gives an insight to the other side of the career and the side where things are actually constructed and made. Certain volunteering roles can also act as good dental work experience and bolster your application. Roles in care homes provide an interesting insight into dental care for the elderly. Care homes sometimes will have drop-in dentists, and they will visit the care home and do as much treatment as possible for residents who can't leave. This makes volunteering with the elderly a rewarding and informative experience for an aspiring dentist. Your volunteering roles should focus on teamworking, communication skills, and public-facing team-working roles. These are the skills you want to demonstrate in your university application.
So unlike with medicine and dentistry, if you're thinking of studying something like biology, chemistry, biomedical science, physics, anything like that, it is not a requirement for you to do specific work experience in order to study those subjects. However, as I mentioned, you will need to demonstrate a real passion for your subject, as well as the skills needed in order to study at university level. So it's really, really important that you can demonstrate a strong enthusiasm for your subject. And to do this, it helps if you read around your subject in addition to everything that you're learning at school. You could even do an online course or attend a free lecture about the subject to really deepen your knowledge. Now, getting work experience that is related to your subject can be really, really valuable. However, I know that this kind of experience is not always possible to get, depending on where you live and lots of other factors. So this is why it's really important that your enthusiasm for your subject shines through. Universities are looking for you to demonstrate transferable skills, things like communication skills, commitment, teamwork. Now, you can easily demonstrate these kinds of skills through any work experience you've done, volunteering, all different kinds of extracurricular activities, provided that you've reflected on these activities and how they are relevant to what you want to do in future. So for example, if you've played sports for many years and you've progressed to being a team captain or coaching younger students, this is a perfect example of you demonstrating your commitment and things like leadership and teamwork. And this is a great thing to include in your personal statement, no matter what it is you want to study. So thinking about my experience of applying to university, first of all, I moved to England when I was 14. And with everything that had gone on in my life, that meant that for a few years, I wasn't really doing very much in my spare time. I did do some work experience during my GCSEs with my mum at the local council, which I'd really enjoyed. But by the time I got to sixth form and doing my A-levels, I really didn't have much going on. And I realised I really need to start doing some stuff to help build up my CV and help strengthen my personal statement. So there was one Christmas where I worked a part-time job for a clothing store. I got involved in a mentoring programme within my school, and I also got involved with a local brownie troupe helping to run activities for children on a weekly basis. And all of that was done in my final 2 years of school before going off to university. So I think it goes to show that it's never too late to start getting that experience, but it is really important to do what you can in your spare time, and it doesn't matter what you do in your spare time, any and all of it can be applied to what you want to do in future when it comes to studying at university.